On behalf, on behalf of USAID, I want to welcome you all to today's discussion on WASH and COVID-19, and especially thank our presenters who are going to be joining us from around the world today. So before we get started, I'd like to go over a little bit of housekeeping about the Blue Jeans platform that we're on that we'll be using during today's town hall. At the bottom of your screen, you will see a slider bar right underneath the speaker's face, my face, and dragging the slider left and right will make either the presenter or the slides they're sharing bigger. And you can choose the view that is most convenient for you. In the right-hand sidebar, there is a Q&A button. When you click on that, you can submit questions or comments for the presenters. Please use this function to ask questions or comment throughout our call, and we'll answer as many as we can at the end. To ask or comment anonymously, please check the anonymous box before submitting your question or comment. To turn on closed captioning, please click on the CC box on the left of your screen. Also in the right-hand sidebar menu, you have a chat button that will open a chat box. Please use the chat box to introduce yourself. Along with your name and where you're joining us from, I also welcome you to share a few quick words on what impacts of COVID-19 you have seen in your own WASH work. So with that, let's go ahead and get started. As we all know, water, sanitation, and hygiene, WASH, is intricately connected to the COVID-19 pandemic that we've been navigating over the course of the past year. While WASH is essential for both prevention and recovery, the impacts of COVID-19 have created new challenges to accessing these services. Ensuring global water security in this new reality will require a clear understanding of how COVID-19 is changing the global WASH landscape and how the WASH sector can best adapt to these changes. One unique challenge of the COVID-19 pandemic has been that the impacts on travel, in-person meetings, and face-to-face surveys have made information gathering more difficult at the exact moment that access to evidence has become more important than ever. Despite these challenges, the presenters you will hear from today have used a wide range of innovative techniques to gather a critical foundation of information that allows us to understand the impact of COVID-19 on WASH services and inform future planning and approaches as a sector as we continue to navigate both the pandemic and future shocks and stresses that will surely come. We will also hear reflections on how USAID's missions are responding to the COVID-related realities that they face on the ground and what needs to be done to create water and sanitation systems that are more resilient to the next crisis. Finally, we will hear thoughts on the implications for water and sanitation policy and how the Water for the World Act supports USAID to strengthen water and sanitation systems now and into the future. So with that background, I'm excited to share with you the results of recent research that we funded at USAID to better understand the impacts of the COVID-19 pandemic on WASH. To present the research, I'm thrilled to introduce Jeff Albert, who serves as the Deputy Chief of Party for the USAID-funded Water, Sanitation, and Hygiene Partnerships and Learning for Sustainability, or WASH PALS project at the Acquia Institute. Welcome, Jeff, and turning it over to you now.
Thanks so much, Jeff. And thanks so much to all our USAID colleagues for the opportunity to report on this work, which was conducted by a fantastic team at the WASH PALS project over the course of many months. I'll be recognizing the individuals on that team at the end of this presentation. Next slide. Next slide, please. Yeah, there you go, thanks. So here's how the presentation is going to be organized. I'm going to lead with the headlines and then run through the methods and a few slides on context before digging deeper into the detailed subsector findings, and then close by laying out some additional takeaways. Next slide, please. So first, the headlines. Now, these pertain to the WASH-related impacts of the COVID-19 economic shock on 7 deep dive countries where we focus the bulk of our data gathering efforts, the details of which I'll describe shortly. Now, in addition to the synthesis report that covers all of these countries, we also produced individual deep dive reports for each. And Natalie, I believe, is going to put those in the chat. All save DRC. DRC will come shortly. Next slide, please. So to begin, COVID-19 effects on water supply. Now, at the outset of the pandemic, the biggest fear of many of us was that water services would be interrupted by crises associated with the procurement of critical supplies, staffing shortages, and so forth. And we were relieved to find in this work that for the most part, continuity has been maintained, and our worst fears so far have not been realized. But with that said, consumers definitely experienced COVID-related water access difficulties. Between roughly 1.5% and 6.5% of those that we surveyed across 6 of the 7 countries, those in Africa, reported a change in modality corresponding to a step down in the Joint Monitoring Program's Water Service Ladder's basic level. And lastly, and perhaps most concerning, the pandemic caused water service providers serious financial pain. And the outlook for them and for particularly vulnerable smaller providers is a cause for concern for an array of reasons that we'll discuss. Next slide, please. Now, with respect to sanitation, and here our focus is primarily on on-site containment and the desludging of pits and septic tanks. Consumers reported far less difficulty than they did with respect to water supply, but this is unsurprising for reasons we'll get into. But still, suppliers of these products and services endured major losses, financial losses resulting from the pandemic shock's impacts on consumer spending, as well as increased operating costs. And this is consistent with what's been reported for firms across multiple sectors, more generally across the developing world in response to the pandemic. Next slide. And finally, with respect to hand washing. Now, here, COVID-19 may be offering us a silver lining. All indications are that hand washing is way up since the onset of the pandemic, which we infer both from self-reports by consumers, but also from interviews with manufacturers and distributors. Where consumers did report difficulties in accessing soap, they described that difficulty in the context of their reduced spending power rather than price increases or the lack of availability. And based on the data we've seen so far, I'm going to suggest that this welcome behavior change may be actually more durable than we would have expected. Next slide, please. So those are the headlines. And now I'd like to walk through, how we collected and analyzed our data. Next slide, please. So we approached this task from 2 angles. First, we conducted these deep dives in 7 countries. Those are the countries in the map at left. 6 countries in Africa, as well as Nepal. And these countries offered a range of geographies and vulnerabilities to shock. And these deep dives consisted of 2 elements. So first, we identified key informants via snowball sampling. And we conducted structured phone interviews specifically tailored for service providers, policymakers, value chain actors in the private sector, and development partners. And we did over 300 of those across the 7 countries. And in addition, we executed at least 500 consumer surveys via SMS in the African countries, conducted by a firm called Geopol. And we sought a sample with a 50-50 gender split, and with a subnational geographic and age distribution that was representative of each country. And I should mention our sampling frame, because we worked with Geopol, our sampling frame was the full customer database of the major cellular carriers in these countries. So that consisted often of millions or even tens of millions of subscribers across each country. And then the second angle was an econometric analysis that examined the pre-pandemic relationship between income and WATSAN outcomes, water and sanitation outcomes that are captured in USAID's demographic and health surveys and in UNICEF's multiple indicator cluster surveys for 27 or 28 countries, depending on water or sanitation. And those are in the map at right. And I'm going to summarize those findings very quickly at the end of this presentation. Next slide. Okay, so it's important before we dig into the detailed results that we consider some important contextual factors. Next slide. Okay, so first, the size of the pandemic's economic shock has not been uniform. At left, you see our own SMS data indicating the fraction of consumers who reported either job loss or an income decline. And you'll see there that the effects in Kenya and Rwanda were more pronounced than in the others. And at right, you see data on firms, and those are captured by the World Bank's Business Pulse and Enterprise surveys. And I've circled Kenya, Senegal, and Ghana's average sales losses in 2020. These are firms between 2020 and 2019. And again, you see that the Kenyan businesses appear to be in much worse shape on average than Ghana's, and Senegal's are somewhere in between. Next slide. Second, restrictions on movement also varied considerably across countries. And this could have been related to how stringent a policy was, or how widely it was enforced, or the level of adherence or compliance. So what you're looking at here are 7-day rolling averages of Google mobility trends from February through October 2020. And these indicate the departure from the baseline amount of time spent in residences. So the way to read this is that the higher the value on the y-axis, the greater the movement restriction was, and in turn, the greater the limit on economic activity was. And what I want to really direct your attention to is how wide the range was in both the intensity and the duration of these movement restrictions. I've also noted when our deep dive period occurred relative to these patterns, as well as the timing of our SMS surveys for 5 of the 6 countries, and then the last one for Rwanda. Next slide. And finally, some really interesting work coming out of Rwanda shows us that the COVID shock and recovery assume what the economists describe as a K shape, whereby different sectors rebound at different rates and to different degrees. So what you're looking at here are turnover trends, revenue trends in different sectors as captured in electronic billing machine data. Again, between July 2019 and September 2020, you see the obvious nosedive of the pandemic shock, and then the recovery. And you'll notice that the construction sector, for example, has recovered much more significantly than manufacturing, wholesale and retail trade, and food and accommodation. Now, interestingly, the recovery of this sector is encouraging on the sanitation side, given that the inputs for on-site sanitation tend to be tied closely to construction inputs, and so that's actually a sign of something that we should feel encouraged by. Next slide, please. Okay, so now we'll dig a little deeper into our results. Next slide. So these are the responses to our SMS survey question. Again, at least 500 surveys per country on water access difficulty. And we asked if the pandemic had made it more difficult that's the precise wording of the survey question. And what you're looking at is the fraction of the respondents who answered in the affirmative. And you'll see on the order of about a third across all countries said that the pandemic had made water access more difficult. Now, you'll note that the 2 countries I highlighted earlier, Kenya and Rwanda, those are places where consumers reported more economic stress. Those also happen to be the place where the 2 countries where the fraction of urban responses reporting water access difficulties exceeded the rural fraction. Next slide, please. Now, in addition to determining if the pandemic caused water stress, we also wanted to find out how it caused that stress. So we asked those that reported that COVID had made water access more difficult. We asked them about their service, how they got their water before the pandemic, and then how they get it at present. And here's a visual representation of that from a follow-on activity that we conducted in Ghana, but we've done this for all countries, and those are reflected in our deeper dive reports. So for example, here you can see that the number of people reporting piped connections, that's either tap or standpipe, the categories at the top, that number declined as you go from left to right. Now, anytime you see a downward sloping curve, that corresponds to a decline or a drop in the JMP water service ladder. So this gives you a sense of how we came up with numbers that I'm now going to present in the next slide. Next slide, please. Thanks. So on the right, we illustrate what we mean by falling below JMP basic. So on the right, that's the Joint Monitoring Program's basic ladder, and you can see the threshold between above basic and below basic. So what we're quantifying here is the number of people in each country that that followed that trend from above to below basic. So at left, each bar represents the number of people in millions whose service dropped below basic, as illustrated. And this assumes that our survey numbers for each country are generalizable to the broader population. Assumption, we're looking at numbers that range from 220,000, roughly 220,000 in Senegal to well over 3 million people in Kenya. Next slide, please. Okay, now with regard to the financial hit absorbed by water service providers, financial performance has really fallen dramatically, and some of this is linked to mandated suspensions of tariff collection. Some is just due to the income shocks incurred by consumers who just haven't been able to pay bills. Now, in some cases, governments attempted to target their tariff holidays, but that targeting was often difficult to enforce, and ended up being blanket tariff suspensions. Now, commercial and industrial customers were typically not included in this tariff relief, and they should have represented a key source of revenue, but they ended up also using a lot less water than normal during the pandemic-driven downturn. And then, to add insult to injury, utilities were often forced to supply much higher volumes than they did before the pandemic. Some of that is public health related, but some of it is just the basic economics of free water leading to much higher usage. But again, what we want to highlight here is that smaller providers tend to have much lower cash reserves, and thus they represent a real source of risk. Next slide. Okay, on to the detailed sanitation findings. Next slide. Okay, so these are the SMS survey results on sanitation difficulties, and you can see much lower numbers than I just showed you for water supply, 2 to 3 times lower. And now this is unsurprising. If you think of how a household's sanitation situation would respond to an economic shock, it's generally going to be a lagging indicator. The delay in installing or upgrading a latrine, the delay in emptying a pit or a septic tank, if suddenly money becomes tight. So unless you're fortunate enough to be served by piped sewer, there's no acute risk of a service loss that in response to an economic shock. Again, in the case of on-site containment, in the way that there might be that from the inability of a centralized water service provider to be able to pay for electricity and run pumps, where you could see water being cut off rather abruptly. We don't really have a corresponding example in sanitation, so these lower effects are kind of what we'd expect, but we'd also expect that they'd be something of a lagging indicator. Next slide. Now, even with consumers not reporting much in the way of sanitation access problems, those businesses which provide latrine service products and services, as well as desludging, generally reported major declines in demand during the major lockdown period in the spring. But interestingly, we also noted that there were some markets where those effects were weak or absent entirely. Rural Ghana for on-site sanitation, for example, really saw no effects. Similarly, the more evolved desludging market in urban Senegal, the providers reported really no difficulties. Next slide, please. Finally, on to hand washing. Next slide. So in our SMS surveys, we attempted to circumvent courtesy bias by asking consumers not if they themselves had increased hand washing frequency, but instead if they witnessed this behavior change among their neighbors and friends. And you can see these numbers are really dramatic. Over half across all countries reported much more hand washing than before. And another 30% or so report a bit more, but these are significant increases in behavior in hand washing behavior. Next slide. Now, we also asked about the ease of obtaining soap in our SMS surveys, and here again, Kenya and Rwanda, those are the only two countries where the fraction of respondents reporting soap access getting more difficult exceeded the fraction reporting that it was getting easier. And the others, those were describing soap access getting more difficult were in the minority. And I should mention here that, again, in follow-on questions, and I'm not going to get into detail on, these declines in access were really related to the specific household situation, and the effective ability to pay. So it was effectively a price increase, a relative price increase, relative to household, what the household could afford, rather than an absolute change in price. And it wasn't also generally linked to any change in availability. Next slide, please. Now, unfortunately, okay, next slide. Okay, no, thanks. Okay, yeah, we're good. Okay, unfortunately, this increased hand washing has not translated into profit growth for the bigger value chain actors. Most of the sales increases were in budget brands, away from the higher margin luxury brands, and also the manufacturers were dealing with increases in raw materials prices, at least for the domestic producers. Now, it's noteworthy that smaller local actors recognized an opportunity here and have entered the market. So our key informants among, again, they tended to be the larger players in different countries, described a much more crowded playing field for the manufacturing of soap. Now, I had mentioned earlier that we should be open to the possibility that this could represent a possible sea change in hand washing. Now, I don't have a slide on it, but if you look at data that have been collected as part of the MIT COVID-19 Beliefs, Behavior, and Norms survey in collaboration with Facebook and Johns Hopkins, for which there's biweekly survey data since July 2020, right through the present. I think they're going to be running it through next month. 16 waves of surveys so far, with thousands of respondents per country. The rates of reported hand washing have remained remarkably high. I'm referring to specifically to there was no overlap between our deep dive countries and the MIT countries, the wave countries as they call them. But the numbers in Bangladesh, India, Indonesia, Nigeria, the Philippines, Thailand, and Vietnam, those numbers remain well above 70% reporting hand washing as a way of dealing with the pandemic. And there's been some decline over the course of, since July, over the course of these last 8 months, but not that much. So, there's a reason for cautious optimism about this hand washing opportunity offered by the pandemic. Next slide, please. Now, one area that I think requires some continuing attention is menstrual hygiene management, MHM product access. We had reports of increases in consumer prices in Rwanda, And in Nepal, producers, where the Wash Pals, I should mention, the Wash Pals project is doing MHM research, much more expansive MHM research in Nepal. We have reports of big increases in production costs, although the respondents in our interviewees claimed that they weren't generally passing those increases on to customers. But this is an area to watch. Next slide. Okay, so I'm just going to go through a couple of additional takeaways before we close. Next slide. Now, I had mentioned that we'd also done some econometric modeling as part of this work. So we sought to produce some reasonable forecasts of how the COVID economic shock could play out, given the historical association between income and wash access as captured in the national surveys like the DHS and the MIX. And I also want to mention this work builds on previously published research by Mark Juland, who's now at Duke, and David Fuente of the University of South Carolina and their collaborators. For us, it was led by David Levine at UC Berkeley and Xinyu Ren. We're preparing this work for academic publication, and I can't get into much detail here, but relying on robust associations between income as an explanatory variable and water supply level or sanitation level as a dependent variable, we tried to predict how service could change in response to a given estimate of economic growth or economic contraction. So using World Bank GDP forecasts across 27 countries, our median estimated effect of the economic shock is that roughly 3 out of 1,000 people dropped one step in the JMP water service ladder, and about dropped a step in the sanitation ladder. Now, these estimates are much lower than those indicated by our SMS surveys and that are implied by our key informant interviews, and we have a few possible explanations for that. One is that the GDP estimates may be low, and so these are linear models. If they're off by a factor of 2, then we'd see twice as much impact on the wash side. Second, we derive our estimates from the long-term relationship between wealth and wash access. So in normal times, households have ways of coping with transitory shocks that are just impossible to deploy during lockdowns. So that could be a part of this. But probably most importantly is that this analysis really doesn't factor in supply side effects, the kinds we were talking about, where, for example, a utility could cease being able to cover its electricity costs, pumps stop functioning, and there are abrupt losses in service. Next slide, please. We've also spoken about the financial peril that water service providers face. And thankfully, donors are responding to that challenge, but in most cases, the recipients of assistance are large urban water utilities. Now, the thing is, in many countries, these large utilities serve a relatively small fraction of the population, and in some cases, large numbers of people are served by a fragmented set of smaller providers. And these, as we've said, these smaller providers are more vulnerable to shocks. They're also less likely to receive assistance from donors. Delivering rescue funds to a fragmented sector with many small actors is administratively and logistically challenging. I wanted to draw attention to a program that USAID is testing in Mozambique. It's an effort to help small providers by directly covering their biggest operating expense, electricity. These are piped providers. By paying the bills directly to as issued by the National Water Company. Now, we're fortunate enough to have in this webinar Clara Di Mani of USAID Mozambique. Hopefully she'll be able to say a word or two about this effort and how it's going. But an innovative idea for sure. Next slide. Now, on gender equity, now we know it stands to reason that women and girls who are typically tasked with water supply and incur the bulk of time and labor costs gathering it when there's no household connection, that they'd be disproportionately affected by wash service declines. We have no reason to believe that that's not the case, but interestingly, those likely disproportionate impacts aren't reflected in our consumer surveys, where we really saw no gendered differences in reported water access difficulties. Next slide. So I just want to end with an important caveat, the limitation is that this study took place primarily during the summer and early fall of 2020. As we've discussed, some of the effects of the pandemic shock are going to take a while to manifest. Whether it's ultimately the inability to empty a full latrine pit, or to upgrade or repair a damaged latrine, or the inability of a water utility to do important maintenance that results in real performance problems. Those could take some time. So continuing tracking of these effects is crucial. Next slide. But before, I'm going to leave this slide up to recognize the team that did this work. I'm just communicating it to you. But at the same time, I'd also like to invite the attendees of this webinar to offer any examples in the chat function of any examples of adaptations or pivots that you've had to make in response to the pandemic's effect on your own operations. And just one more acknowledgement slide here. As I had mentioned, we had interviewed hundreds of key informants. I can't name them here, but what you've just seen was really a function of their generosity in terms of time and expertise. Thanks. If you could go one slide back, I'd love to leave the team. Yeah, that's great. Thank you so much.
Great. Thank you so much, Jeff, for your work on this research and sharing these really robust findings. And I'm really glad that you ended on kind of that note about the point in time at which this data was collected. And just to highlight that we at USAID are committed to continuing this type of data collection and making sure that we have longitudinal data on the impacts of COVID-19 on WASH over the long term as this pandemic and situation kind of continues to evolve. So just a quick reminder to folks who have joined midstream to please submit questions in the chat box, or the Q&A box, excuse me, on the right-hand column or sidebar throughout the presentations. And we'll seek to answer as many questions as we can at the end of our presentations. So we'll now transition to some short reflections from colleagues at UNICEF, the World Bank, my colleague at USAID Mozambique, and WaterAid America. So shifting gears, just as Jeff noted in his presentation, it is clear that one of the greatest risks facing the WASH sector is that of service provider financial stress. And to learn more about this, we'll now turn to Gustavo Saltied, who's a global lead for water supply and sanitation at the World Bank, to share perspectives from their work, including findings on impacts of COVID-19 on service providers. So Gustavo, over to you.
Thank you, Jeff. Good morning, good afternoon, good evening, everybody. Thank you also to the USAID for the invitation and opportunity to present the work that the World Bank is doing on urban water. That will be the focus of my short presentation, and building back better. I don't know if you can project my presentation on the screen. Thank you. Yes. So building back better, resilient and inclusive urban water supply and sanitation systems. So I will focus more on what's next. But let me start by what we know now. Next, please. And from the USAID work and our own work and other organizations, we know that COVID-19 has impacted water utilities and water supply and sanitation service providers in multiple ways. Loss of revenue, increased operation and maintenance costs, water consumption by commercial and industrial customers decreased. In general, I'm talking about utilities. It may not be the case in smaller service providers. Household consumption increased. Shifts in demand patterns over time have generated operational impacts. And what is also very relevant is the deferment of critical investments. Some research we have done has demonstrated that on average, many utilities have delayed critical CapEx activities for more than 6 months, with clear impacts on service provision and access. Next, please. We also know that utilities can play a key role in building back better from COVID-19. And what do we mean by building back better? Is to use the opportunity that COVID-19 provides to do things that perhaps we should have done before, do it in a better way. And utilities can play a role in incorporating a wide range of shocks and stresses when restoring services and planning future infrastructure development, incorporating also something that not always utilities do, water basin, watershed approaches and green solutions in their planning, adopting circular economy approaches whereby wastewater is not considered a waste but rather a resource, ensuring an inclusive approaches and engagement of local communities, engaging the private sector to mobilize additional resources, and also to create job opportunities by engaging communities and local private sector, in particular in small works. Next, please. We also know that COVID has created an opportunity for building resilience, to understand what's going on, to be more aware of the problems that shocks can create in service delivery. And so these opportunities are reflected in the possibility of incorporating resiliency concepts into planning infrastructure, planning service delivery, and planning investment. Resilience not only to pandemics and to climate change, but all types of shocks. Diversifying sources of financing, thereby increasing the possibility of investing in resilience. Using more different frameworks for resilience, and I'm here only citing two of them, but there are many. So incorporating resiliency planning in the business of utilities. And all of us, the development community, working with governments, also to institutionalize the idea of resilience into wash service. Next, please. So for the World Bank, what we are trying to do, and we actually started this initiative before COVID, but we believe that COVID is again an opportunity to spearhead the idea of a utility of the future. How do we define the utility of the future? It is a future-focused utility which provides reliable, safe, inclusive, transparent, and responsive WSS services through best fit practices that allow it to operate in an efficient, resilient, innovative, and sustainable manner. And I know what many of you may be thinking. This is everything under the sun. And can we really do this today when utilities and service providers all over the world are suffering such a massive crisis? The answer is no, but this is more a vision, a trajectory that we would expect our clients and partners to work towards and maybe achieve this idea of this vision in 5-10 years, not necessarily today, but it's a vision and a trajectory that we intend to instill across the different dimensions of a utility. Of course, operational, financial, also human resources, technical, regulatory, etc. Next, please. We are currently working with more than 18 utilities, actually around 23, 24, in different regions in 13 countries, supporting this initiative through 13 World Bank loans, which is basically mainstreaming the idea of the utilities of the future. Next, please. And for building back better, we are putting in place in our operations, but also our technical advice clients, a package of different initiatives. In addition to utilities of the future, what we call the enabling environment, the external environment to the utilities or governance, which is the policy, institutional, and regulatory PIR incentives. Also, supporting maximizing finance for development that includes private financing and private sector participation and engagement in service delivery, circular economy and resilience in urban water, I already mentioned, and citywide inclusive sanitation, that is a holistic approach with a mix of solutions for sanitation. So in support of our clients for this vision of the future, of the utilities of the future, but also recovering from COVID and building back better, we are bringing all these initiatives together. Next, please, to conclude. Just wanted to give you a few examples of different types of of activities that we are supporting. For instance, in Argentina, a recently approved World Bank loan of $300 million is supporting the Buenos Aires Water Supply and Sanitation Program for results, addressing the health and environmental risks posed by COVID-19 in the greater Buenos Aires vulnerable areas. It's a program for results, paying for results. In India, in Shimla, with the first corporate utility created in India, we are supporting the utility to move in the direction of the utility of the future, but also the government in building the PIR enabling environment. In Ethiopia, we are repurposing an existing operation to ensure that all healthcare facilities have continuous access to water pumps and boreholes in the capital in Addis. And in Haiti, we are working with them, supporting. We actually started right after the crisis, the COVID crisis erupted, supporting the country in purchasing chlorine, hand washing stations, soap, water supply in critical areas. So these are just a few examples of the types of interventions. Thank you very much, and we'll be happy to answer any questions you may have. Over. Thank you.
Thank you so much, Gustavo, for sharing the World Bank's perspective in your work on this. And I think, as you noted, the impact on service providers has certainly been significant and really kind of corroborates what Jeff was talking about in his presentation, and that their ability to continue providing services is core to preventing backsliding in access. What really resonated for me was one of the biggest impacts on service provider well-being that you noted is the implementation of policies in response to COVID-19. I think that's a perfect segue to better understand the policy response landscape. We'll hand over to Jorge Alvarez Sala, who's a WASH specialist with UNICEF, to talk us through UNICEF's work in this space. So over to you, Jorge.
Thank you. Well, first of all, I would like to thank USAID for the invitation to participate in this webinar and for the opportunity to share with you some of the work that UNICEF, together with SIWI, has been doing over the last year of the pandemic in analyzing the response and the secondary impacts of COVID to the WASH sector. But first, allow me to reflect a little bit on the findings that Jeff and Gustavo have presented on the impacts of COVID-19 pandemic in water, sanitation, and hygiene, and the potential future impacts. USAID's WASH Pulse have done a great job compiling information from deep dives in 7 countries, plus the 28 USAID high priority countries. If you haven't looked at the document, I strongly recommend you to have a deeper look at it after this webinar. COVID has made water access more difficult for people, in particular the most vulnerable ones. We all know that. Declines in water access have linked not only to economic shocks borne by consumers, but also to financial pressures endured by the water service providers, as they suffer revenue for shortfalls, which are a function of both government directives for free water provision and tariff collection difficulties. And that affected both rural and water service providers. Water suppliers face major financial challenges and, to a lesser extent, operational obstacles related to supply chain disruptions and price increases for chemicals, hardware. But beyond the, let's say, expected temporary impact of drop in revenues, which we hope or we expect to be temporal, one of the concerns is on the long-term impacts of the, for instance, the expansion of services, renovation of infrastructures, etc. We can see similar challenges and trends in sanitation services, with difficulties to access of users, reduced demand and revenues of service providers, and difficulties of getting supplies during the first phase of the lockdowns. I presume that now most of those difficulties in supplies are, I would say, solved. Self-reported hand washing behavior is difficult to measure and track, but different analyses show that COVID has contributed to increase the practice of hand washing. The key question is what will happen next, and whether we will be able to maintain those rates after the pandemic. Some anecdotal evidence from Southeast Asia might suggest that there will be a slight decline in the practice. So this might be the time to re-emphasize the importance of hand washing with soap beyond COVID. Now, if we move to the next slide, let me briefly introduce some of the work that UNICEF, together with SIWI, started in March, April 2020. At that time, UNICEF was working closely with WHO and other partners in the development of technical guidance and supporting the work that UNICEF has done at country office level with the WASH response to COVID, supporting governments and partners. But beyond those interventions, we started an overview of initiatives from countries, mostly from governments, regulators, utilities, and other WASH stakeholders. So those measures that were put in place, in particular during the first months of the COVID-19 response. This exercise was initiated in the Latin American region and quickly expanded to the entire North Africa, Middle East region and to other countries, as you can see in the map in the middle of this slide, to complete in total 84 countries. You can see in this slide the 3 areas of UNICEF WASH response on the left side of the slide and the 5 targets of the mapping exercise, which included awareness raising campaigns, infection prevention control measures, maintaining WASH services for all, including the most vulnerable groups, guaranteeing continuity, affordability, and safety, and the last point on provision of technical and financial support to the service providers and the users. The mapping showed regional disparities between and within regions, and the level of activity found in the countries varies largely, both in terms of ambition as well as scope. Hygiene promotion and other IPC measures were widely adopted in the first stages of the COVID response, although not always matched in ambition with the assured availability of soap, water, hand washing facilities, at least during the first months of the pandemic. Overall, the support to vulnerable groups at the scale to promote basic access to WASH services was and is still weak and needs additional focus, particularly in rural areas and small towns, and in schools where acceleration of WASH preparedness measures for safe school reopening may be required. In addition, parallel support needs to be extended both technically and financially to service providers or to households themselves in the form of cash transfers in order to ensure the financial viability of utilities and the continuity of services. Finally, more focus going forward will need to be given to the overarching aspects that support a resilient, enabling environment in the face of a pandemic. Areas of focus could include developing specific pandemic response strategies and preparedness plans based on robust evaluations of the current response, strengthening coordination mechanisms, including intersectoral coordination with other sectors such as health, and establishing emergency financial support mechanisms for water utilities and operators. Overall, the findings of this mapping help gain a better understanding of the nature of the WASH response interventions and ultimately contribute to enhance current and future pandemic prevention and recovery. On the right side of the slide, you can see some of the publications related to this mapping exercise in 44 countries, including the specific Zoom reports for MENA and Latin America Caribbean region. Besides the mapping of measures in 84 countries, UNICEF continues to use its internal data management systems to monitor some key indicators, such as changes in WASH services, supply chains in 159 countries, which with the next round of information being collected at the moment. So hopefully in a few weeks' time, we will be able to measure whether in the last 6 months there has been any improvement in such indicators. Now, if we move to the next slide, please, I would like to briefly introduce you with the ongoing work to understand the mid and long-term secondary impacts of COVID to the WASH sector, which is, I believe, the second part of this is what we know. This is what I presented is what we know, but what is next? So as you can see in the slide, there is some work to understand these mid and long-term secondary impacts of COVID in the WASH sector based on literature review and discussion with WASH stakeholders. As you can see in the slide, the research questions include what are the main secondary effects of WASH? So we are analyzing both positive and negative effects of wash sector. One positive impact, for instance, is the increased use of hand washing with soap. There are, of course, many negatives, but I think it's important to also focus on the positives. How does the context influence of these secondary effects? By analyzing the influence of the enabling environment on the type of effects and their manifestation. And last, which are the linkages between the response and the positive and negative effects? So analyzing the cause-effect relationships between specific response measures and the effects created both positive and negatively. As I said, this is work in progress, and we expect to publish the report, this new report, next month. However, some of the preliminary conclusions pretty much coincide with what USAID and the World Bank already identified. USAID estimates that service providers will mostly avoid major disruptions in the next 6 to 12 months, thanks to the financial assistance from the development banks, bilateral, multilateral aid institutions. However, this might be only part of the picture, in particular in the case of large urban water utilities. But we have to acknowledge that a very large proportion of water service providers, in particular in rural areas, have not received any type of financial assistance. In my personal opinion, it is a bit early to understand the real impact of COVID to the finances of WASH service providers. Some of them were already operating below the full cost recovery standards and receiving some kind of external government subsidies in different ways to continue providing those services. Like with the big banks during the 2008 financial crisis, water utilities are too important to fail, in particular in urban areas, and governments are supposed to come to the rescue for those critical basic services. But beyond that lifeline for the big utilities, the big question is up to which extent other important activities, such as the expansion of services to new users, the renovation of the infrastructures, will be delayed as a consequence of the drop of revenues. Not to say the anticipated or the expected reduction in ODA investments to the wash sector as a consequence of the economic crisis in all donor countries. We agree with the diagnosis made by USAID report that smaller pipe water supply systems are susceptible to system disruptions, particularly in contexts where they had to suspend tariff collection for extended periods of time in response to government policies and mandates. However, it's still unknown, first, what is the actual impact on the ground of those government announcements of tariff suspensions. We know that in some cases, utilities continue to collect tariffs, although some governments announce tariff holidays. The second point is how the process of collecting tariffs after months of suspension is going to impact both utilities and the households. And the third point is there will be some adjustments in the water tariffs in the near future. So how those tariffs are going to be kind of introduced gradually, and I presume that there will be some discussions in the near future on a revision of the tariff systems. I will stop here. My apologies for this slightly long monologue, but I look forward to clarify any questions during the Q&A part. Thank you.
Thank you so much, Jorge. UNICEF's work has been just instrumental throughout this process, and the policy mapping and your work on secondary impacts is really helping us collectively as a sector have a better understanding of what's going on the ground. And I love that you, it's a perfect segue and tee up to talk about what's going on the ground, because in Mozambique, our mission has been continuously adapting their Water for the World programming to address the evolving realities that we have been talking about and prepare for future shocks. So I'm very, very pleased to introduce my colleague, Clara de Mene, the WASH project specialist at USAID Mozambique. She joins us here to share more about what the experience has been to date on the ground in Mozambique. So Clara, over to you.
Thank you. Hello, everyone. It's great to have this opportunity to participate in this discussion and also to provide some insights from USAID Mozambique's mission on the situation and the impact of COVID on WASH services provision, and also doing this presentation based on the study that was presented by Jeff. Thank you. Next slide, please. Next. So I would like to start first providing some context of Mozambique. So if you look at the slide, you can have this overview of the scenario on WASH and COVID in the country. You can see the challenges as accessing basic services of water and sanitation, and also on health facilities. And in terms of COVID, so far until last week, we had around 60,000 cases, and we have around 1% of deaths. In this context, the government of Mozambique has come up with a response plan, and they have identified the needs and come up with a response plan of around 50 million. And this has been targeted by the government and also the different stakeholders. We have been targeting around 1.5 million people, as you can see in the chart. Next slide, please. In terms of considerations based on the WASH bulk study, we would like to highlight some thoughts, such as, the first one is that we like that the study makes a good description of the situation in the ground and details very well the initiatives that are ongoing to respond to COVID, and also provides a comprehensive data that will be very useful to and informative for decision making in the country, which was something that we didn't have much, and this will contribute to the sector data. Another point is that since the country was already going through an economic recession when COVID started, we find difficult now to know if these financial challenges that we are stressed by within the study for the providers and also the consumers, considering that this recession, and we are asking ourselves if these challenges are not also a consequence of the recession that we already have. And to add on this, the study also points out that the financial impact in Mozambique ranks higher compared with other countries which we are also studying. Next slide, please. The other thought is that the study focus more on the hygiene matters, which is natural, and like the availability of soap and for the prevention and control of the spreading. But for us, it will be also interesting to further explore the challenges on what is in place in terms of sanitation facilities, particularly in peri-urban areas where live the urban poor, where they live in cramped and inadequate sanitation facilities, increasing the risk of disease spreading. We think this is something that we will need to explore some more and come up with more information. But from this context, we also map some opportunities based on the study findings, and also based on the work that is being performed here. We see that we find it interesting to develop the opportunity to develop some mechanism to respond to emergencies, such as how do we ensure that although we have this situation like the pandemic, how do we ensure that the continuity of the service and also the sustainability of the providers to do their business? And this is something that USAID has embraced. We have developed a grant. We are implementing this grant in partnership with the with the UNICEF, and it intends to subsidize the operational costs on energy and chemicals to the providers in the rural areas, small towns, and peri-urban private operators, which we think this will be very, very, very helpful to ensure the continuity of service delivery and also to motivate the providers to continue with the delivery of the service. Another thing that we found very, very important that was raised by the situation we are going through is the role of coordination among the different stakeholders in the sector. I'm talking about the stakeholders within the sector and the multi-sector stakeholders that we have managed to discuss and intervene in coordination through some platforms that are in place and which seem to be very crucial for the effectiveness and of the intervention on the COVID response. Next slide, please. Continue on the response. I would like to also highlight the work that was determinant for the activities that are being performed to respond to COVID, such as the prompt mobilization of or the development of a response plan by the government that was presented to the different stakeholders within the sector. Also, this coordination that I was talking about, through platforms, and I can mention particularly the platform of the WASH cluster, which is led is coordinated by UNICEF, and which is very important. It has been very important to avoid the overlapping of activities and also target the different parts of the country in terms of COVID response, and also looking at other issues such as the natural the disasters that we have. In Mozambique we had the situation with the cyclones. So through this platform, we are able to respond in terms of WASH needs along the country, and fulfilling the needs of the people in different parts of the country. And USAID has also, besides the water continuity service grant, we are also implementing financial stress assessment, in this looking at the peri-urban providers, which seem to be the ones who face more challenge in terms of ensuring the continuity of this service. But as you know, these providers, they depend on their own resources to invest and provide the service. So for us, it's important that if they are able to continue to provide the service, half of the population in Mozambique will also continue to have to achieve the water service, the water service. And also, we are working with different stakeholders within the sector, such as the Water and Sanitation Regulator, in which we have provided some informative tools on the rational use of water. Those we are some leaflets and also some posters to build awareness on consumers and also the providers on service delivery. Next slide, please. Well, we also see some opportunities raised from these challenges of manage COVID within the wash sector. The first thing I would like to highlight is the need to better integrate the programmatics on basic service in public areas, particularly in schools and health health facilities, to prevent diseases spreading. This is something that, particularly in schools, that we notice that there is a gap here in Mozambique. With COVID, we noticed that the challenge in terms of accessing to basic sanitation in schools is a real problem, and it's something that we think that the programs and also the country policy should address more to ensure that the country is better prepared to deal with these issues such as the pandemic. The other issue that we think we need to address better within the sector is the consolidation of monitoring tools, and also ensure that we have data to be prepared to respond, to intervene, and and respond to the needs. We have some tools within the sector, such as the which is a platform that provides some data on water systems and points in the country. But we have challenge in terms of updating this with data, and also using this information for decision making. We need to do more in terms of support also the community self-reliance, also to maintain and sustain the intervention, and also on budgeting for maintenance. This is something that I think we could do some more. And finally, we need to consolidate this coordination platform. We have seen that they are very, very useful. We need to have something more clear that works when we have this kind of situation. But not only maybe we could. It will be interesting to have something like a platform that will work, will coordinate at least once in a year in terms of activities that are being performed. But this is a policy. This is an approach that we need to discuss and maybe adopt for move forward together, and without any repetition and lose of resources and efforts. That will be all from my part. Thank you. Over.
Thank you so much, Clara, for your leadership on the ground and for these insights. In the midst of such a challenging year, it's so encouraging to hear how USAID Mozambique is addressing these issues and looking to strengthen WASH resilience for the future with innovative solutions like the Service Continuity Grant, the financial stress testing, and the coordination with the Global WASH Cluster that you mentioned, among other things. The importance of this particular aspect, strengthening WASH resilience for the future, is more evident now than ever. And as we think about how we use the insights shared today in responding to COVID-19 and strengthening future resilience, we are joined by Liz Marcy, the Director of Policy and Advocacy for WaterAid America. And I'm thrilled to turn it over to you, Liz, to give some of your thoughts on the insights shared here today. So over to you.
Thank you, Jeff. I wanted to kind of chime in and just say that, first of all, it's a pleasure to be here, and I wanted to thank the team for their work on this report and the contribution of USAID, particularly in shining a light on what we're experiencing within COVID and WASH. I also wanted to take some time to look forward and see how we can relate the findings of this report to perhaps informing better policy, frankly. And I think what we all know is that WASH is critical to saving lives, particularly in a pandemic. It's critical for our economic and global health security. But what this report has shown is that, in particular on the economic side, the impacts of WASH are very nuanced. And that WASH can be both a victim and a safeguard mechanism for an economy. And so we saw as purchasing power decreased on the household level, but governments continued the importance of delivering WASH within existing systems, the economic pressure on providers became stronger and stronger, as well as increasing input costs, and the ability to deliver is now in jeopardy. And in frankness, this is not economically sustainable. But we also know that there is no other tool other than masking that is really important, particularly in a pandemic. And so the pressure to keep the tax on is very high. And so what we've seen in this is that WASH is really a critical component, not just in safeguarding and containing the spread, and particularly slowing variant development because it slows the spread. But it's also important in helping economies open back up. So the MIT survey that Jeff mentioned at the very beginning also found that the number one thing that businesses and consumers needed to see in order to go back to retail settings was hand washing stations. And that's across 70 countries. That was the number one thing. And so without continuing access to WASH and increasing that access, we are still going to be at a loss in terms of our recovery long term, which then of course has trickle down effects both onto the WASH sector itself and our ability to move forward. So in terms of the global health security component and what this could mean for our policy, particularly within the US bilateral space, one of the things that I'm really keen to have an increased understanding on, particularly of policymakers, is, as I mentioned, the role of WASH in slowing variant trajectory and development. Every time a virus mutates, it's because it's copied itself. If you're using hand washing and you're using social distancing and masking, it's less of a transmission, which means fewer opportunities to copy itself and fewer opportunities to mutate. And therefore, we kind of see that WASH is a critical enhancement of the timeline that we need to deploy the current vaccines to maintain their efficacy within 2 years. And at the same time, this report really showed that we are seeing drops in access to below the basic water level, water access level with a JMP. And what that is concerning for me is that is in addition to seeing these emergency measures rolled out by governments, and you're actually seeing in some instances expansion of access because of the fee relief and the tariff reductions. But at the same time, again, we are still seeing that drop. And so one has to wonder, what is this going to look like in 2 years when we will still likely be, hopefully at the end, but still likely still pushing back in terms of COVID. And the backslide, as we mentioned, has had a face of many colors, if you will, with I think in particular Kenya seeing tremendous shift from using piped water back to surface water, back to ponds and rivers. And then in particular for the sanitation value chain, seeing the fecal sludge management and fecal processing market just not becoming nearly as profitable, and as across the entire sector seeing those profit margins shrink. And so this kind of comes to the point of, well, what do we do about this in terms of policy? And I think one of the things that we've really learned in this pandemic is that the Water for the World Act really emphasizes services that last. And what this means is that when we're looking at situations as this pandemic, we have to double down on that. But we also need to broaden our views of what it means to have sustainable services. And frankly, a development intervention like setting up safeguards, particularly for the small service providers who are intermediary between the large service providers and the last mile, is a very vulnerable space. And that has to be addressed if we're going to actually have sustainable service continuation. And so we're seeing development tools actually take on an acute humanitarian role in this pandemic, and particularly thinking about how we need to bake in and pre-bake for this pandemic and as it continues, but frankly the next one, because it is going to happen again, how do we respond and support the current wash systems that we have and try to mitigate some of the backsliding that we're already seeing. And then I just really quickly wanted to just highlight here that we have a huge opportunity. I think each one of the speakers has touched on the fact that we have behavior change in hand washing. I know there are a lot of questions in the text box around that, particularly around what we saw after Ebola, where we saw a tremendous uptick in hand washing and then fell back. This is I would pose that this is a different situation and that this is a fully global piece, and we're starting to see, even when we think we're comfortable with the new variants, we're starting to see changes come out. And so at WaterAid, we tend to think of things as behavior shaking versus behavior changing. And this is one of those that it shakes you to the core. This is an instance that shakes you to the core. And we also know that people are much more likely to pay more to keep the access that they have than to gain it in the first place. That continuation for all of us on many things, particularly policymakers, it's easier to maintain and to keep what you have than to have it go away. And so that threshold of what you're willing to pay can increase. And those two things are incredible opportunities to capitalize on what we know about people's behavior towards wash. So by putting in the safety net systems that we need, particularly for those small service providers, and maintaining that we do expect shocks to magnify on the sanitation side, although it's more insulated, but looking at that long term, and combined with some of these behavioral pressures that are naturally occurring, trans-border, as we all look at our behavior and everyone is washing their hands, and everyone is thinking about the importance of that and what they would be willing to pay for it, we have this tremendous opportunity to put some serious policy change forward. And I think that it's up to us as practitioners and frankly as implementers to advise what that needs to look like. And I think that one thing is really clear here is that the humanitarian response needs to include more development-like tools, including financial support for those small service providers. So I will stop there, and I know that we wanted to have plenty of time for Q&A, so back to you.
Great, thanks so much, Liz. It was a really, really robust discussion. I just want to thank all of our presenters for sharing evidence from your respective institutions, insights and perspectives. And I think it's clear that this information will be tremendously helpful as we continue to address the COVID-19 pandemic and look to making sure that we have a resilient water and sanitation sector to future shocks and stresses like the impending climate crisis as well. We know that many of the same variables and factors will likely play out in that context as well. We have had a lot of questions come into the chat box, and I just want to affirm that we will be following up with all of the presentations, the reports that we've dropped into the chat box, and then the longitudinal data that I mentioned that we are committed to investing in on the USAID side as well. Liz just touched on, I think, what was a key theme that was emerging in the chat box as I was monitoring it about the durability of hand washing kind of spikes that we've seen through COVID and how that compares to past experiences with Ebola. I think, Liz, you did a very nice job of addressing that. So I might actually just, we've got about 5 minutes and then I want to close with some thoughts. So maybe I could just pose to each panelist what you think, kind of having heard all of this, is kind of the most critical priority or concern from your perspective moving forward and your top recommendation from where you sit. So maybe we can just kind of go in the order of our presentations, and I'll turn it over to you, Jeff Albert, for a quick reflection.
Yeah, thanks, Jeff, and thanks also just to all the amazing presenters, and thanks for these great questions. You know, I'm not a hand washing specialist or behavior change specialist, but I spent a lot of time looking at numbers, and I think, you know, what Liz, I'm glad, you know, Liz indicated that I think the magnitude of this event is really unparalleled in our lifetimes. You know, Ebola, where Ebola is occurring, or cholera outbreaks and so forth. Well, that's waterborne, but you know, where you have an outbreak that requires this behavior change, there's just nothing we've ever seen by this. So I'd argue that we have to be careful about what we infer about what happened in Ebola, because it's not really necessarily a comparable event. And the scale, I think we have to pay attention to the scale of the changes that we're observing, and these are being corroborated by value chain actors who actually are moving the soap. So I think we clearly have to. There has been a decline. The MIT data set is probably the richest one we have over time, and it does. We have to be honest about the reality that there we do see these declines, but they're not dramatic. Now, again, we're still in the pandemic, and we'll be in it for a while. But I guess what I'm arguing is that the scale of this is such that perhaps it provides opportunities to achieve levels of change that we haven't previously. I mean, this is such a hard nut to crack.
Yeah, fully agreed, Jeff. Gustavo, over to you for any final thoughts on top priorities or concerns that we as a sector should be thinking about moving forward.
Thank you, Jeff. Yes, I think, key message that I would have in concluding is, again, to stress the importance of service providers. I'm focusing now on the urban service provision, urban wash service provision, focusing on strengthening their role, allowing them, providing the resources needed to increase access to wash, in particular in peri-urban areas, through different modalities. This requires also that governments and regulators are mindful of the financial needs of service providers. There are very good examples, in particular in Latin America, with regulators that have taken special measures to allow service providers to trade some CAPEX investment obligations for operation and maintenance costs. So governments in Latin America in particular, others as well, have been very proactive in facilitating the work of service providers, utilities in particular, ensuring access to water everywhere. There are excellent examples in Africa as well, like Cape Town. Cape Town has taken a very also proactive approach in providing water in settlements of the city. So you need, my takeaway message, not only in terms of responding to the wash needs of the underserved populations, but also thinking of the future, thinking of the recovery and building back better, strengthening the role of utilities and water service providers with a very proactive government policy and regulatory policy. Thank you, Chef, and thanks everybody for the opportunity.
Thank you. Couldn't agree more. Those are hugely important points on the overall policy environment to make sure that we adapt to this or any future shock or stress so that we have a resilient water and sanitation sector. Jorge, over to you for any final concluding thoughts or perspectives from UNICEF's side.
Yeah, we cannot forget that we are still in the middle of a pandemic. Although some countries are moving forward with the vaccine and there is a perception that, we see a light at the end of the tunnel, but many countries will continue to be in, let's say, pandemic or emergency mood for quite some time. However, I think it's important to, at this stage, to start thinking on what we have learned from this. So what needs to continue? Just very briefly, maybe continue maintaining this emphasis on hand washing with soap. We know that this prevents other diseases, cholera, other waterborne diseases. What needs to change radically? Well, water is at the center of public health. We know in the wash sector, but not many people outside the wash sector realize the importance, the critical importance of wash in preventing public health emergencies and in responding to public health emergencies. And there is something very critical, which is wash in healthcare facilities. There is no such health care in a place where there is no water and sanitation. Full stop. What should not be repeated? In my opinion, we shouldn't go back to business as usual. We need to build back better. In different areas, in different contexts, is different, but we need to focus more on resilience, on sustainability, on revising the tariff systems, making sure that when there is a big economic social shock, there's proper support mechanisms to make sure that people is not disconnected because of lack of payment. And what we should avoid is reducing investments in the wash sector. There is an economic crisis coming as part of this COVID. We need to make sure that the wash sector is not defunded as a consequence of this economic crisis. Thank you very much.
Thank you so much, Jorge. Clara, over to you for any final thoughts on prior user perspectives from your vantage point.
Thank you. So for me, it will be, multi-sector coordination. I think the coordination plays a huge role when we have this kind of emergency. The fact that the different stakeholders are able to sit and discuss the interventions and the resource is good to maximize from the work that is going to be performed. And I also agree a lot with what Salah just said. In general, we need to learn from our experience. What is not okay? What we could do better? And I think that is something that we really need to sit and learn and make some guidance to face the other type of challenge that may appear. Over. Thank you.
Thank you so much. Liz, any final rallying cry for us before we wrap up?
We'll always give a rallying cry. I think, one of the things that really strikes me about this is that we have to revisit what we consider to be sustainable development. And I think that that's been a theme that all of us have touched on. And we tend to talk about it in WASH as a part of a natural resource management ecosystems component, but it also has to be the ultimate stress test of a global pandemic. What are we doing to set up systems so that when this happens, and it continues to happen, that we do not backslide? And how do we shift from response in humanitarian crises like this to one that is preventative on the front end? And that requires for WASH, I think, a special look at mechanisms that can be set up, and particularly targeting those that are most vulnerable, particularly those small service providers that are the in-betweeners that we know are at a really precarious point. I don't think any of us want to walk away from this in 2 years and see a complete backsliding on SDG 6, but we very well may see that. And then frankly, I think that there needs to be a global rallying cry and a greater understanding that without WASH, there is no recovery or stopping this pandemic period. We need WASH to have economies function. We need WASH to keep the variants from continuing to spread. We need WASH to treat. We need WASH to continue to buy time while we get those vaccines into people's arms. It's going to take some time. And frankly, if it's not there, this could continue on for a while. And so we see WASH more as a tangential kind of piece, and that the vaccine is coming. It is coming. But it's going to take that time. And until we start to pivot a more integrated development and humanitarian nexus based in WASH, in the immediate term, we need to think about this as the emergency bridge. And WASH is that cornerstone arch, if you will, of the emergency bridge. So that's what I would leave with. But look forward to the discussion. Thanks, Jeff.
Great, thank you so much. And just again, a huge thank you to our presenters for a really robust discussion. And we are at time, but I just want to conclude with a couple of notes from USAID's perspective, and really just to highlight that Water for the World programs have, throughout this period of the pandemic, been leveraging our networks, expertise, and relationships to promote critical access to water services, ensure continuity of services for communities, healthcare facilities, and schools. But as everybody just highlighted, the scale of this challenge is really greater than the assistance that we can provide alone as the U.S. government, and the need for expanded support to the WASH sector in partnership and collaboration within the sector has never been more clear. And I think today, just really represents kind of the ethos by which we are hoping to approach collaboration moving forward, recognizing that our respective commitments to investing in evidence to make sure that we can make the correct pivots is well communicated and that we're sharing. And with hundreds of millions of people potentially facing challenges accessing basic services, potential backsliding, as Liz just noted, accelerating progress in WASH could not be more urgent right now. And even once we beat the pandemic, reliable access to WASH services and the strength of service providers will still be the cornerstone of rebuilding economies. We've noted that COVID-19 represents a once-in-a-generation shock that we've seen to global WASH services, but it's important to realize that it's not going to be the last. I mentioned earlier at the start that the climate crisis in particular will continue to impact WASH services in the coming years, and that we know that up to 90% of climate disasters are water-related. So where responses to COVID-19 have showed the value of new innovations and approaches, we'll need together as a sector to rapidly harness those opportunities to help build back better. And in cases where COVID-19 has shown gaps in WASH services, we need to strengthen the resilience of WASH systems to respond even more capably to shocks and stresses of the future. So just thank you again to everybody. We've had fantastic turnout for you all joining us this morning, and we look forward to sharing these resources with everybody and continuing to collaborate as a sector to make sure that we can collectively confront these challenges. So thank you so much on behalf of USAID, and looking forward to continuing the conversation with you all in the coming weeks and months. Thank you.